In this video, I will show you what medications I use to control the symptoms of laryngopharyngeal reflux myself. As I have discussed in my previous video, laryngopharyngeal reflux, or LPR, is defined as the backflow of stomach fluid to the larynx and pharynx, or the lower throat region. People with LPR have weakness in both lower and upper esophageal sphincters. Both the stomach acid and the stomach enzyme pepsin play an important role in the damage to the lining of the throat area in people with LPR. The activity of the enzyme pepsin is pH dependent. Pepsin is most active at a pH of 1.5 to 2. As the pH rises, pepsin loses activity and is irreversibly inactivated at a pH above 8. A few years ago, I started to take omeprazole, which is a proton pump inhibitor, for my LPR symptom relief. After 1 year, I tapered myself off omeprazole due to the concerns of side effects. I replaced omeprazole with antacids and famotidine, which is a histamine 2 blocker. The antacids I take are calcium carbonate and baking soda, which is sodium bicarbonate. Antacids control symptoms of acid reflux by neutralizing the acid inside the stomach. Although antacids take effect instantly, they need to be taken multiple times because they are short-acting and do not affect the acid production by the stomach. Antacid should be taken after meals or as needed for symptom relief. Baking soda, which is sodium bicarbonate, is inexpensive. At Walmart, 16 ounces of baking soda costs $0.50. When taking baking soda, it is very important to pay attention to the amount of sodium in it. Each teaspoon of baking soda contains 1,259 milligrams sodium. I normally dissolve half a teaspoon of baking soda completely in 1/2 glass or 4 ounces of water. I take small sips of the solution and let the liquid flow down my throat slowly with each sip. The alkaline sodium bicarbonate solution not only neutralizes the stomach acid, but also inactivates the pepsin in the throat area and thus reduces its damage to the lining of the throat. Although the maximum daily dose of baking soda or sodium bicarbonate is 3.5 teaspoons, I usually do not take more than 1.5 teaspoons a day to minimize the sodium intake. 1.5 teaspoons of baking soda contain about 1,900 milligrams sodium. The daily recommended sodium intake is no more than 2,300 milligrams per the dietary guidelines for Americans. People should not take sodium bicarbonate in the following situations: children under 5 years of age because of reported seizures and respiratory depression in children, when the stomach is overly full from food or drink. Stomach rupture can occur due to the production of large volumes of carbon dioxide or neutralization of stomach acid by the ingested bicarbonate. Do not take sodium bicarbonate within 1 to 2 hours of taking other oral medicines. Do not take sodium bicarbonate if you have any signs of appendicitis, such as stomach or lower abdominal pain, cramping, bloating, nausea, or vomiting. Do not take sodium bicarbonate with large amounts of milk or milk products. In addition, sodium bicarbonate should be used only for occasional relief. You should consult your physician if you take sodium bicarbonate regularly. If you have high blood pressure, heart failure, or other medical conditions that require you on a low sodium diet, you can try low sodium or no sodium salt to minimize the total daily sodium intake. Morton light salt contains 50% less sodium as compared to the regular salt. 11-ounce Morton light salt costs about $2 at Walmart. No Salt Original does not have any sodium in it. It contains only potassium. 11 ounces of this salt cost about $5 at Walmart. When sodium bicarbonate alone does not adequately control my LPR symptoms, I add another inexpensive antacid, calcium carbonate. The liquid calcium carbonate costs 2.4 cents a tablet. Each tablet contains 1000 mg of calcium carbonate. The maximum dose is 7 tablets a day. You should consult your physician if you take the maximum dose of calcium carbonate for more than 2 weeks. For further LPR symptom relief, I take 20 mg of famotidine at bedtime. Famotidine is a histamine 2 blocker. It suppresses stomach acid secretion by 70%. Famotidine takes about 60 minutes to be effective for symptom relief. The effect lasts up to 12 hours. People with moderate or severe kidney impairment should decrease the dose of famotidine. If you need to take famotidine for more than 2 weeks, you should consult your physician. Famotidine is inexpensive. 20 mg of famotidine costs about 5 cents a tablet. With strict adherence to the lifestyle changes I mentioned in my last video and intermittent use of antacids such as baking soda and calcium carbonate in combination with famotidine, I mostly keep my symptoms of LPR under good control. In summary, the symptoms of LPR can be difficult to control. Long-term use of proton pump inhibitors such as omeprazole, pantoprazole, lansoprazole, etc. can cause significant side effects. From my personal experience, strict lifestyle modification and intermittent use of antacids and histamine 2 blocker such as famotidine can lead to good symptom control with minimum side effects. However, my treatment regimen may not be applicable to everyone. Before you start any treatment regimen, please consult your physician to have a definitive diagnosis of LPR and seek your physician's advice on whether this type of medication treatment is appropriate for you. Even if your LPR symptoms are controlled with lifestyle modification, antacids, and histamine 2 blockers, you should continue to follow up with your physician for regular evaluation.